Well, for the first time in the history of the health service, junior doctors and consultants are to strike together. Members of the British Medical Association will walk off the job this month and next after voting to continue strikes. But the NHS has called it a serious escalation in the union's row with the government over pay and conditions, saying it will be an unprecedented challenge for the health service. Well, of course, it'll be an unprecedented challenge for the health service because you've got loads of people downing tools. But I don't know about you. I was initially a bit sceptical about all of this because I thought the timing of it's interesting, isn't it? It's going to coincide with Conservative Party conference, which makes it seem to me like this is overtly political. I'm also reading here on the government website, most eligible doctors will receive at least a 6% pay rise. Pay for junior doctors will be increased by an average of around 8.8%. Consultants earn around £135,000 a year. But I went out and about a little bit earlier on to talk to some patients and a couple of staff as well outside a local hospital to see whether or not they thought it was right for junior doctors and consultants to strike at the same time.
Something has to be done, yeah, I think they should. They've been at it long enough. Every other strike they've done, nothing's really happened for them. So they need some help somehow, so really a bit of striking needs to be done, doesn't it?
No, definitely not.
Why not?
I think they should stage it and stagger it. Because they're putting everybody at risk and relying very heavily on the registrars and the other staff to carry the load for them.
Okay.
And I don't think that's right.
If you're prioritising patient safety, maybe not. On the other hand, it will have a bigger impact for their cause.
We should have the service, we should maintain the service at all times, so we couldn't have both seniors and juniors out at the same time. I don't think it's...
Yeah, well, there we go. I thought it was fascinating, though, to hear a bloke in scrubs there who told me that he was a junior doctor, saying that if you're prioritising patient safety, then going on strike alongside consultants is not the right thing to do. So, surely they're not prioritising patient safety. Dr Robert Lefever, who was a NHS doctor for 17 years, joins me now. Look, Robert, thank you very, very much. Do you support these strikes?
No, I don't. I think that medical practice is a vocation and we should never go on strike. It inevitably harms patients. The issue of money is one of whether junior doctors are appropriately paid. When I was what's now a level 1 doctor, I earned £3,000 a year. That's the equivalent of about 10,000 now. And I lived in the hospital. I got out for 2 weekends in the entire 6 months, and I was married and I had a child. But I learned my trade. I was working all hours that God made, and it was good for me to learn my trade, and that's how I did it. So I think there are two issues. One is, are doctors well paid? And I think the term junior doctor is a misnomer because some of these junior doctors are in their 40s. And anybody who's less than a consultant counts as a junior doctor. So I think we need a better term for that. But it's used politically nowadays, a junior doctor. And the requirement to have more money is universal. Everybody wants more money. But we have to be aware that the country cannot afford to pay everybody absolutely everything that they demand.
No, and do you think that the timing of this is both catastrophic and political? Because yesterday I reported on 120,000 people dying whilst on NHS waiting lists, and today, obviously, it's emerged that they're going to be striking right in time for Conservative Party conference and holding a demonstration, I believe, in Manchester, which is where the Conservative Party conference is. So if you cared about patients, you probably wouldn't be on strike. Is this just an attempt to try to bring down a government?
Well, I care about patients. I've seen a patient already today. I don't work as a GP anymore. I work as a counsellor. And I charge for my time, which is perfectly reasonable. And I think it's perfectly reasonable that doctors should charge for their time. But when you get a situation where doctors are holding the country to ransom, holding patients to ransom, I don't think that's right.
No, indeed. I'm having a look at the pay scale here for junior doctors, and, you know, it is obviously, by definition, a sliding scale that can start at around £28,800 and work all the way up, as far as I can see here from the notes from University College London, anyway, to around 68 grand. Consultants, as you will know, can be on around £130,000 a year plus. I'm just not sure that it's right to strike if you're on £130,000 a year and you know that there's a massive NHS backlog.
Well, the strike movement is a political movement. If you look at the pay of, train drivers or tube train drivers, they earn a lot more than doctors. And one could say, well, they're more likely to kill people than doctors, but I don't think that's true. If you look at the mortality rate in Canada some years ago, when the doctors did go on strike, the mortality rate went down. Well, how about that? I don't think the Canadian doctors would be going on strike again very quickly if they publicised that.
So that is fascinating. So, as far as you're aware, in Canada, when doctors went on strike, fewer people died, which is an interesting aside to this particular discussion, I suppose. What would your message be to people who are striking? Because I just, to be honest, I'm on the side of patients, right? And that's where I am, and there are millions of patients. Everybody conceivably at some point in their lives will be an NHS patient. I'm on the side of the millions of people who are on an NHS waiting list. And when the government has offered them a pay rise that will work out as an average of around 8.8% for junior doctors, I mean, what would your message be to those people who are going to go on strike in October?
8.8% is more than most people are getting. My message is consider the patients, consider the patients, consider the patients. Get back to work.
OK, short and sweet, direct. Robert, thank you very, very much. There's Robert Lefever there, who was an NHS doctor for 17 years. He's certainly not mincing his words when it comes to the doctors' strike.